Hi, everyone, and welcome to this recording for the questions, answers, and rationale for our first exam in healthcare ethics. So what I'm going to do is just sort of talk about a variety of things during this recording. And obviously, hopefully you have you're following along. This will stay up all semester as well in case you want to go back, listen to one component of it, and certainly feel free to ask me any questions. Okay. So it's the same exam whether you took it individually or then sort of in the team format. But at the end of the day, it's your exam, even though you have the ability in the team format to discuss with each other. It's really important that you use all the information, but as you've sort of figured out, the answers are not on your page. You have to synthesize and apply stuff. So let's start. First question has to do with QAR1, the article specifically, which is focused on empathy. And in the next last paragraph, the author says pain wants authenticity. Let me make sure I got there we go. From an ethics perspective, what does this mean? So the key for every single question is to focus on the ethics issue. What is the ethics issue here? And, certainly this article, this is really about empathy. If you recall, the author, who's a physician, wants to be told, directly what are the issues, what's going on. Other patients require more of a listening perspective. They just want to be listened to. So what you'll find in the responses is you want to be able to focus on the ethics issue. So I'm just going to talk about this. The answer for this is C, understanding patient experiences without providing a response builds trust in the patient-provider relationship. Okay, so ethics issue, patient-provider relationship. That is a key part, a theme that we've discussed in a few contexts, but also key to this notion that empathy is a vital part because it builds trust, and understanding the experience of patients, what they're going through. If you recall in the article, it wasn't so much she wanted something different, but then she also told the story of her dog and how an emergency medical technician didn't say anything. That wasn't a patient-provider relationship, but understanding that experience without saying anything really invites trust. The other statements, A, B, and D, they are absolutely correct. They are correct statements, but they're not connected to the ethical issue. So if you look at B, patient autonomy is a vital component of the patient-provider relationship. 100% true. It is not connected to pain wants authenticity, and it is not connected really to the story. A and D, I pretty much are also true, but they're not connected to what the question is asking or really the ethics issue. So you want to be able to go through every single one of the answers and always ask yourself, what's the ethical issue here? And then you drill your way down. And so in the rationale part, you can certainly, many of you use the term empathy as well, but trust in the relationship between patient and provider. Okay, so I want to be able to see a variety. There is no specific 100% correct answer in the rationale, but you've got to come pretty close. All right, so let's keep going. Number 2 has to do with Jean, which is, or remember the case about Jean, the soccer player. However, the question says, in deliberating case, HIPAA came up. Which one of the following responses below is a HIPAA violation? And so HIPAA violation has to do with really three things: a violation of privacy, security, or confidentiality. Now, you have to tease this out, but the answer for this question is A. You're driving your roommate to the emergency department. She had all these issues, but a nurse mentions to you that your friend has ingested a very high content of acetaminophen. In the rationale, now this is clearly a HIPAA violation. The nurse should have not told you as a roommate. Didn't say anything here about a guardian or perhaps someone who has legal authority. If it's not in here, don't make it up. So this is really a type of statement that even though you knew what happened to Jean, this is about HIPAA. And but you have to be able to identify what component of the HIPAA violation it is. And the other three things are not at all HIPAA violations. B, I think many of you might have chosen that. The nurse walks in, she's looking for something, the doctor keeps talking about stuff. HIPAA violations really are when individuals who are not in the business of knowing what's happening. Now, the nurse who walks into the room, we don't know if she's involved in the case or she's just waiting outside while the doctor is examining stuff, but this is sort of a normal type of behavior, right? Now, if it was let's say, housekeeper who walks into the treatment room, stays for 2 minutes, listens to everything, then it would be inappropriate for the physician to keep talking. But this is clearly a violation of privacy. You have to be able to single this out as privacy. And so within the context, what's the ethical issue? It's really about the violation and specifically privacy. Okay, so let's go to D. Consider the documentary, Keepers of the House. Highlights the stories of housekeepers. What's the primary lesson learned from the documentary? Again, focus on the ethics issue, because there's lots of things that come out of this. So let's go through these. Housekeepers, A, are among the lowest paid employees, but might interact more with patients than the clinicians. From the 15-minute video, which is on the Blackboard site, that's a true statement. It is an absolute true statement. In fact, in class, I believe I brought up a job description at USI, and it showed the pay scale of housekeepers or custodial staff at USI, lowest paid employees. True, not an ethical issue. I mean, it's unfair, perhaps unjust, especially if you're seeking that position. There's a rationale for why it's a lowest paid position, but it's not the ethical issue learned from the documentary. Housekeepers are skilled at noticing, which allows them to make important interventions for patients. And that was a part of the video and the discussion afterwards. They are skilled at noticing certain things, partly because families, patients maybe feel less threatened to speak to a housekeeper than a clinician. But it's not connected to the ethical issues. But quite honestly, I think if most of us had the skills, the noticing skills that someone in a housekeeper position does, because they're taught to notice stuff. They learn that, whether it be a spill, whether it be something out of line in the room or in the bathroom, they can connect better. But it's not the ethical issue learned from the documentary. See, the majority of housekeepers are women and racial and ethnic minorities. A true statement. True across the country as well. Zip code matters. I mean, it always matters, but that's not the primary lesson learned from this. D, they bring empathetic awareness to patients. What's the ethical issue? Empathy. Empathy is the issue there, and they're aware of what is happening, whether it be, and if you remember some of the stories, and this is an example that you can bring up in your rationale. Only a few of you did this. The story of, I believe it's the oldest housekeeper who connected. She actually was holding hands with the patient who happened to be an inmate. He wanted to give up. And she just said, don't give up. I mean, she was very aware, despite his condition, not the medical condition, the fact that he was more than likely going to go back to being incarcerated. Or one of the housekeepers who brought food to, I think, a family member, very aware from an empathetic perspective. And so if you provide examples in here, food or holding hands, coming right from the video, that really helps your rationale. So use examples, and the examples are in front of you. Okay, I'm going to keep going. Number 4, the phrase just getting by appropriately summarizes the invisible patients. What's an example of this? I'm going to go a little bit quicker here. First of all, who uses the phrase just getting by? It's Pat. And, you know, she's talking about a variety of things. She has issues with her health insurance. It fluctuates from being insured, not being insured. We're not sure about if she's selling opioids, using it. We're still not exactly sure. But just getting by really summarizes this from a social determinant of health perspective. This is the ethics issue that we spoke about in the context of the invisible patients. And so Pat's insurance is dependent on her income level, and they both fluctuate. And so, you know, to bring in there that based on social determinant of health, Pat, you know, at least in this example, her income fluctuates. She's not sure if she has appropriate health insurance. She can't see Jessica. It is based on income. How are they going to afford this? How are they also going to afford food? The other statements are correct. They're correct, but it doesn't tie necessarily, in fact, at all, into the ethical issue, which is social determinants of health. Okay, number 5 here is really focusing on one of the arguments, and there's many that come out of the COVID vaccine article from the New England Journal of Medicine. What I think is key is, and I'll recommend this, is it's one thing to find the argument, but really the crux of the question is, what's the ethics rationale? I understand what they're saying because I've read the article, so you don't really need to summarize it, but how is this connected? Now, what is it really connected to? Use the stuff that we've talked about. Use the stuff, autonomy. We've talked about informed consent as well. Use the ethics terms that we have already discussed. You don't have to make anything up because it's right in front of you. All right, 6. 6 is the zip code matters St. Louis discussion, the 2 zip codes. How are the social determinants of health relevant to health outcomes? And so what you see with A, B, and C is specific outcomes, whether it be fast food, whether it be substance abuse, or 80,000 income. So the fact of, if you look at A, residents in 63106 tend to eat more fast food, which is cheaper. We're not sure if that's correct. We know, first of all, that they are more obese with higher levels of heart disease. That is correct. But we don't know if they eat more fast food. My guess is fast food is cheaper. That's more of an educated and experiential guess, but we don't know if they eat more. Residents in 63106 are 4 times more likely to have substance abuse issues. That is correct, because of their high frequency of drugs in low income area. I suspect that's correct, but we don't know that for sure. First of all, what I'm saying is with A and B, you're guessing. Don't guess. C, residents in 63105 are on average 18 live longer, 18 years than 63106. We know that's correct. The $80,000 media income primarily influences this income. In outcomes, sorry. No, income and outcome. Wow, I never even realized that. it influences it. I'm not sure if the word primarily. So that's a guess as well. The large gap in the percentage of individual people with bachelor's degree or higher. Okay, so that's the number is exceedingly high in Clayton and exceedingly low in North St. Louis City. Influences health in terms of access to housing and median income. That's correct. Social determinants of health. So, sorry, I had something on my screen. Because when we've spoken about this in class, the fact that individuals have more education doesn't necessarily mean they're automatically going to have better income, but they have access to better housing, better income. In fact, if they have better income, or let's say higher income, not necessarily better, higher medium income, they have access for different styles of housing or different types of housing in other zip codes. And so that really is key. And that is what social determinants of health are all about. It is individuals don't necessarily all make the best decisions. We don't. But where you live, other things that determine your health, your education, your income, your housing impacts the rest of your health. Okay, so the last question is number 7. Which example best portrays the primary ethics conflict coming from Heinz's dilemma? For what is the primary ethics conflict? It is the conflict between intention and action. Now, I want to go a little bit further. It's not just the conflict between. What happened in Heinz's dilemma? He had very good intention, but he made a pretty bad or the wrong action. So good and wrong, right? He made the wrong thing, and so he's going to go to jail. Good intention, wrong decision, wrong action. Which one of these is the exact same thing? B. In fact, this is the same response as earlier. It's the exact same thing. Intention as the nurse is to inform you, the roommate who drove her, about your friend. She did the wrong thing. She violated her privacy. And now you see, I'm using the term good and wrong. You can use right, wrong. So just thinking about intention and action, which is the primary ethics conflict, won't necessarily give you have to go one step deeper. What was the primary ethics conflict? It is the conflict between intention and action, but the fact that Heinz had a very good intention, he just did the wrong thing. It's the exact same thing in B. You have to be able to allude to this over here. Okay, folks, so this is a long recording for this summary podcast. Please take a look at everything, or I hope you've learned something at least. Ask me any questions as well, but I hope it helps in terms of understanding how to maneuver through the exams. You're going to do 4 more of these. Lots of opportunity to keep getting better along the way. And you will. You're going to have to think a little bit differently, but it'll happen. Okay. All right. Thanks very much.